Blame it on Omicron, Minister Lawrence Wong tells Singaporeans to expect a new wave of COVID-19 cases in the coming days and weeks.
I feel good. It was not painful.
I asked my mom to bring me here so I can feel more safer.
P4 to P6 pupils telling the Straits Times they're feeling good about getting vaccinated against COVID-19. And in smart parenting, why are more parents choosing infant care for their child before their first birthday? Good evening, you're watching The Big Story with me, Haryanto Dimana. You can subscribe to the Straits Times channel so you never miss a single episode. Look out for a new wave of COVID-19 cases in the coming days and weeks. There's a message today from Finance Minister Lawrence Wong, who is also the co-chair of Singapore's COVID-19 task force. In a social media post, he says it is inevitable that Omicron will spread in our community as it has in countries everywhere. We must expect a new wave of cases in the coming days and weeks. This comes as protocols are being adjusted to manage the Omicron cases in the same way as for Delta. And so from today, Omicron cases will be allowed to recover under the Home Recovery Program or be managed at community care facilities and hospitals instead of being isolated at dedicated facilities. The Health Ministry says those who are unwell will be processed based on both their clinical presentation and underlying risk factors. Those who are well but test positive for Omicron will continue to self-test and self-manage. And their close contacts will be issued a 7-day health risk warning where they will be required to self-test with ART daily before leaving their homes. The Manpower Ministry says around 52,000 employees in Singapore have not taken any COVID-19 vaccine. Of them, about 6,700 are 60 years old and above and are at a very high risk of severe illness or death from COVID-19 infection. MOM also notes that 98% of the workforce, excluding self-employed persons, have been inoculated. Now, these updates follow the Health Ministry's announcement last night that unvaccinated workers will not be allowed to return to the workplace from January 15th next year. This even if they test negative for COVID-19 24 hours beforehand. Partially vaccinated workers will be given a grace period until January 31st next year to complete their vaccination regime. Meanwhile, vaccination will be a mandatory condition for the approval of new applications for work passes, long-term passes and permanent residence in Singapore from February 1st next year. Those renewing their work passes will also have to be vaccinated. But this will not apply to children below 12 years old and those who are medically ineligible for vaccination. Professor Dale Fisher is here. He's a senior consultant at NUH's Division of Infectious Diseases. Welcome to the show, Professor. Professor, what do you make of the move to allow Omicron cases to recover at home or at community care facilities instead of being isolated at dedicated facilities? What does it signal to you about what we now know about this new variant?
Thanks, Haryanto. Yeah, there has been a pause, obviously. You remember that our strategy, which began back in August and through September, was the cautious stepwise exit from the pandemic. Now, this was sort of progressing slowly, but then South Africa reported this new variant, the Omicron, on November 26th. So we're literally a month ago since that was reported, and obviously we knew about it, but we had to wait for the science to catch up, if you like. And in fact, our leaders had to make decisions even without having the science at hand. The early science was that there was increased transmissibility and possibly reinfections, suggesting escape from immunity. But that was based on young people, a lot of university students, and we know the severity is different. So we had to wait for more information to see if it was actually worse worse than Delta or the same, or ideally even less severe. So in Singapore, it was actually a little bit easier because of our stepwise exit from the pandemic. We haven't actually removed all our restrictions, obviously, with masks and things like that, which have had to be reintroduced in Europe. Our biggest change, I guess, was in testing of travellers, decreasing the vaccinated travel lanes in an attempt to contain Omicron. But it's obviously different when you're treating two viruses differently, when you're easing Delta restrictions, but you're tightening up on Omicron restrictions. So this is not sustainable. So what we've got now is increasing evidence that severity is not greater. So this means that we can align the two approaches and stop worrying whether it's Delta or Omicron, and just get back to the business of the stepwise exit from the pandemic.
Professor, the Health Ministry says to expect more community cases and rapid doubling of infections in the coming days and weeks. Will that lead to Singapore having to tighten measures like what is happening in the Western countries right now? Rightly so, as you mentioned, in Europe, where they have to reintroduce mask wearing.
So there's little doubt that Omicron will replace Delta. We've seen some incredible changes in the numbers overseas. But if it really is milder, then it's a good outcome, really. You couldn't have designed it better, that you've got a more transmissible virus that will replace Delta. And if it turns out to be milder, or at least not as bad, then this is quite a good thing. In the US, it only took like 3 or 4 weeks for Omicron to go from 0 cases up to being over 70% of all their cases. So as has been the case since August, when we began the transition, we really only need to tighten the measures if hospitals are under threat. And they're certainly not under threat at the moment. 98.7% of our cases are asymptomatic or mild. And today we've only got 26 COVID positive cases in ICU. And I must say 15 of those cases, still the majority, are in the unvaccinated. So about a month ago, we had 140 cases in ICU, but now the ICUs are only using about 50% of their capacity. So Singapore's strategy, which has been patience as you exit the pandemic, as opposed to other countries which have done this sort of Freedom Day approach, I think it's allowed us to be more resilient through these unknowns evolving, through these changes. When you remove all the restrictions, pardon me, you've got the challenge of having to manage public sentiment, which is all the reversals, the yo-yoing around, reversing decisions, reintroducing restrictions. This is very challenging, and in Singapore, this was less of a challenge.
So, Professor, from what we know so far now, that the Omicron variant is more transmissible than the Delta variant, and it's already here on our shores. Is it on its way to becoming the dominant strain in Singapore, like in other countries? And if so, if it's more transmissible, what is the worst case scenario? Or are there any positives to Omicron replacing Delta as the main variant?
Yes, I alluded to this earlier, that it's a lovely outcome if you actually end up with something more transmissible to replace Delta and actually be milder. School's still a little bit out on whether it's milder, because you have to apply it to different populations and the vaccination status and past infection status. But really, there's no sensing that it's more severe, and that's the most important thing at the moment. And also the other thing that's most important is that it's not escaping the immunity, whether it's immunity through vaccination or through past infection. It's not escaping that in terms of severe disease. Like Delta, we know it's escaping that and not stopping the mild and asymptomatic disease. But as long as the vaccine and past infection protects against severe disease, that's the most important thing. So I think we can be confident with the current early status of the science regarding Omicron, I think. I don't actually think, you asked about the worst scenario, I don't actually think that the worst case scenario exists with Omicron. I think most likely we can revert to the existing plan with the circulating virus and sort of amalgamate the two approaches and living with COVID and having confidence that the vaccine is being protective. I think actually the worst case scenario still lies in a possible future variant. We've spoken about disease X many times before. This still worries me. Not a lot. I'm not losing sleep over it, but I think that is the worst scenario, is that if you get a variant that actually escapes the protection provided by the vaccine. We know that people unvaccinated are still getting very ill. If suddenly the vaccine didn't work because of the mutations in a new variant, then we would be somewhat back at the start, trying to create a new vaccine, vaccinate the whole community again. And this is why we need to keep on top of the evolving genetics and understanding how any new variant, which will occur, how it affects us. So I hope we can work out how to be resilient to the new variants and not shutting the borders every time we have a new one. We have to get more resilient in a way, more smarter than that, because the social and economic impacts of closing borders are not small, as you know, Haryanto.
Professor, thank you so much for your insights. Professor Dale Fisher, Senior Infectious Diseases Consultant at NUH. 104 new Omicron infections reported by the Health Ministry last night, comprising 73 imported and 31 local cases. They were among the 209 new COVID-19 cases confirmed yesterday. 105 were community cases, 4 from the migrant worker dorms, and 100 were imported. The weekly infection growth rate stood at 0.58. Now, yesterday's case numbers came as MOH revealed that 546 confirmed Omicron cases have been detected here as at Saturday, December 25th. This figure comprised 443 imported and 103 local cases. MOH also said none of the Omicron cases have been severe so far, and infected patients have not required oxygen support or intensive care. The nationwide COVID-19 vaccination exercise for more than 300,000 children aged 5 to 11 got underway today, and so far more than 40% of next year's primary 4, 5 and 6 students have signed up for their jabs. Multimedia journalist Chow Suen spent the morning at one of the pediatric vaccination centres.
It's 8 a.m. at the Pasir Ris Liars Community Club, and children from primary 4 to 6 are walking into the vaccination centre, accompanied by their parents. They will be among the first children in their age group to receive a long-awaited vaccination. This centre here is one of 7 centres opening to children starting today. The remaining 8 will open early next year. Some of the children were quite nervous, but later described the experience as fairly painless. We caught up with the children and their parents after the vaccination to find out how they were feeling.
We were the first one to come, thinking that there'll be a long queue for the kids and the parents, but luckily everything was well organized.
I feel good. It was not painful.
At last the kids get vaccinated too, so we're not too worried if let's say we go out together. Actually, just the moment they receive it, straight away apply for it. The earliest is the best, especially school holiday. So anything we can at least replicate at home, yeah.
I feel great and relief because now we can go out more and then not feel so worried.
I'm a bit nervous and scared because I'm really scared of needles, so I asked my mom to bring me here so I can feel more safer and better and more brave. Not as pain that I expected. It's like some ant bite me.
I'm happy that he got his first vaccination now, before school reopens. So it's a perfect week for him to rest.
What was reassuring was that inside there was a lot of superhero posters and cartoons, which really kept the kids entertained and keep them feel calm throughout the entire process.
I think it's a relief that actually finally she can take the jab. Then because right now, because my mom is actually very old, so that's why I think it's quite a relief for us. We believe all the science that's behind it. I think it's a responsibility of everyone.
We spoke to several parents who shared with us that they were very excited about this pediatric vaccination program, and many were very enthusiastic about bringing their child down today. Now, many also told us that they are very pleased that their child was able to get the jab this week, knowing that it is the school holidays and that they will have the rest of the week to rest. Chel Suen for the Straits Times.
In our Smart Parenting feature today, we are focusing on how we care for children in the first few years of their life and why many families are no longer relying on auntie babysitters and domestic helpers to look after their babies and toddlers. Infant care places for babies aged 2 to 17 months old have surged by 66% in 5 years in Singapore. According to the Early Childhood Development Agency, or ECDA, the number has grown from 6,200 places in 2015 to about 10,500 in 2020. Joining us now is Dr. Geraldine Teo Zuzarti, Vice President of Curriculum and Research at Preschool by the Park. She's also a fellow at the Education, a Childhood Development Agency. Welcome to the show, Doctor. Doctor, how do parents decide if infant care is the best choice for the family? A big factor will, of course, be the cost, right? Let's look at the pros and cons. Let's start with the pros first. What are the advantages of putting a child in infant care?
Often parents start considering infant care because they must return to work for a variety of valid reasons. Fundamentally, it is important to remember that infant care is group care. In other words, the child will be placed in a space with other infants. That said, all infant care centres in Singapore are regulated by the Early Childhood Development Agency. This means that staff need to meet stipulated qualifications and there are standards for the programs offered. Infant care, therefore, is not custodial care. It is professionalized care and education for the very young child. One of the key advantages of being in infant group care is the opportunity for socialization, especially for a child who may not have peers of similar ages or many siblings. Another key advantage is language models. We know from neuroscience studies that the window of opportunity for language development for children is in the early years. This means that very young children need consistent language models to observe for language acquisition. Just these two advantages alone would make it worthwhile to consider putting your child in infant care.
And Doctor, infant care, of course, may not be ideal for some families as well. What are some drawbacks and concerns that parents might have about putting their child in such an environment?
First, let me assure parents that research has shown that children cared for in infant care do not fare worse off than children being cared for at home. A local study done by the Singapore Children's Society in 2019 reported that the informed choices made by parents does not have a negative impact for the child in the long term. The keyword here is informed. Parents need to be comfortable with the choice of care they choose for their child, whether it is home-based or group care. What is important is to find a care arrangement that meets the family's need. For instance, infant care services have fixed opening and closing times, and perhaps for parents who have shift work hours, this might prove challenging. Another consideration that I mentioned earlier is that infant care is group care. This is an important consideration because it means that the attention given to the child is not going to be one-to-one all the time, at least not during the times outside of feeding, diapering, and showering. I think it is important for parents to manage their expectations for the kind of care they would like for their infants.
Doctor, just to round up our discussion for today, let's say the decision is made to put the child in infant care. How do parents then prepare themselves as well as their child for it?
Once the decision is made to enroll the child into infant care, I think it is important for parents to be aware and acknowledge the anxiety that may be felt in the days leading up to the first day of infant care. It is a transition for both the parents as well as for the child. So speak with the centre about how they will manage the child's journey and experience from home to centre. This is important because research again has shown that for children to settle in well and establish good relationships with other adults outside their families, home to school transitions are critical. The focus is on the continuity from home to school in relations to routines like feeding, diapering, sleeping, as well as practices and experiences. Discuss with the Infant Care Centre about how they manage these transitions with families, and as well communicate how you would like to receive updates and communication about your child. The relationship you establish with the Infant Care Centre is an intimate one, a partnership, not a service, and something you should take time to nurture. The effort put in the beginning months when your child is enrolled in infant care will benefit not only your child, but give you the peace of mind, knowing that your child is cared for by professionals you trust.
Thank you, Doctor, for your perspectives. Dr. Geraldine Teo Suzarti, Vice President of Curriculum and Research at Preschool by the Park and a Fellow at the Education Childhood Development Agency. You can read more online about why more parents are choosing infant care for their babies at str.sg/smart parenting. And for more tips, sign up for the ST Smart Parenting newsletter on how to help your child succeed in life. And those are our top stories for today. For more news and videos, visit straitstimes.com. And remember to subscribe to our YouTube channel by hitting the red button below. I'm Haryanto Diman. See you tomorrow on The Big Story.